Hi everybody, good morning. Am I audible and visible? Okay, so good morning everybody. Let's start with today's session. So today's session is on concept of health and disease. Everybody, we'll be looking at the MCQs from a couple of topics today, which is levels of prevention, control, elimination, eradication. ठीक है, PQLI, HDI, Global Hunger Index, case fatality rate, secondary attack rate, all these things we will be discussing today's session. Okay, now guys, if you find that the sessions, if you're not able to squeeze in time for the session, some of you messaged me, ma'am, they're not able to squeeze in time. Absolutely no worries, guys. What you can do is, whenever you have little bit of time also, just go through the PDF if possible. Okay, or if you don't have time, just stick to the LRRs, which was for 5, which is on Prep Ladder's YouTube. Okay, these sessions are meant to master the PYTs, guys. Okay, so that you don't get out of track with PSM. As you all know, PSM is a very scoring subject. Okay, so anybody who has any doubt, please send it to me. I mean, keep it for the end of this session. So we are doing today concept of health. Alright, do this question. I will just send the PDF on the Telegram group. 1 second. I'm just going to send. I always forget to send the unannotated PDF. 1 second, okay? Alright, so meanwhile you can try this question, guys. I'm just sending the PDF on my Telegram group. Some of you were asking the link to the Telegram group. It's in the description box. So you can find it over there. Okay? The link to the Telegram group is in the description box. Alright, so I've sent the PDF. Let's begin now. So the question is, which of the following are not components of PQLI? So yeah, I have sent the PDF, guys. Okay? Now not the components. I have not asked components. Infant mortality rate is PQLI. Life expectancy at birth is HDI. Okay? Literacy rate is PQLI. Okay? Life expectancy at 1 year of age is PQLI. Under 5 mortality rate is obviously not PQLI. Okay? Not PQLI. So don't be in an immediate rush and end up marking components of PQLI. I didn't ask you the components of PQLI. I just twisted the question and said which are not the component. Okay? I'm just trying to show you a place where you can end up making a mistake. Okay? Here it was not. So what are not the components of PQLI? So the not जो है वो क्या है? 2 and 5. Is it clear, everybody? Answer is option B. So don't be in a rush while marking. So we'll just quickly revise the difference between PQLI and HDI. You all know what is PQLI, guys. PQLI, the mnemonic is ill. Ill means infant mortality rate. L means life expectancy. Infant matlab 1 year. So at 1 year. And what is L? Another one, infant mortality rate, life expectancy at 1 year, and this is literacy rate. ठीक है? What do you mean by HDI? If अगर कोई ill है, if you don't take care of the person, obviously the person is going to die. So that is kill. ठीक है? So what is skill? Knowledge index or education index. And what is knowledge index, education index? Mean year schooling as well as expected years of schooling. I over here stands for, we are talking about development. We should see right. Development always depends on income as well. So what is this income over here going to be, guys? The income over here is actually going to be your gross national income in purchasing power parity, GNI per capita. Alright. And the other L is, we should look at development right from birth. So life expectancy at birth. The scoring of PQLI 0 to 100, HDI is 0 to 1. Current rank India का 134 है और score is 0.644. Am I clear? Everybody, will you remember this? One expected MCQ, HDI का concept was given by Which organization? Was it WHO? Was it UNICEF? Who launched the concept of HDI? Anybody? Which organization gave the concept of HDI? Everybody. Which organization launched the concept of HDI? So it was given by UNDP. Okay, don't end up marking WHO over here. HDI ka concept was UNDP. We will expect a question on HDI and PQLI. Any doubts? Keep noting it down, guys. Next one. Media population is the denominator in. Anybody remembers? I had given you a very golden point over here. Where do you have the media population as denominator? Media population is the denominator in. I've always told you guys, whenever you get in a question death rate, ठीक है? Like यहाँ पे it is CDR, here it is crude death rate, right? Here it is crude death rate. What is crude death rate? We'll revise in demography also. Crude death rate is nothing but total number of deaths per 1000 mid-year population. ठीक है? Total number of deaths per 1000 mid-year population. Mid-year population we take it on 1st of July. Okay? Wherever you get the death rate, it will always be in the denominator mid-year population. कभी भी death rate आएगा ना question में, mid-year population उसके denominator में होगा. जैसे age specific death rate, again you will have the denominator mid-year population. Suppose in the exam you get child death rate. Now you should remember कि what has ma'am said? Ma'am has said that whenever it is death rate, the denominator is mid-year population. ठीक है? Now child death rate means death between which age group? 1 to 4 years. Mid-year population किस age group में देखेंगे? 1 to 4 years per 1000. Moral of the story, wherever you see death rate, your denominator will not be live births, will not be total population, will not be anything else. It's just going to be mid-year population. Give me a thumbs up everyone. ठीक है? क्रूड बर्थ रेट में भी mid-year population होता है. क्रूड बर्थ रेट इज टोटल नंबर ऑफ लाइफ बर्थ्स per 1000 mid-year population. That's okay, that we will discuss. CFR आज डिस्कस करेंगे. व्हाट इज केस फैटेलिटी रेट. MMR we will discuss in some other lecture. Maternal mortality rate and ratio and neonatal mortality rate, that will be taken up in preventive pediatrics. चलो, let's go to the next one. Which of the following is not a part of global hunger index? Which of the following is not a part of global hunger index? What is your answer here? Under 5 mortality rate, malnutrition, inadequate food supply, infant mortality rate. अब इसमें गड़बड़ नहीं होना है. ग्लोबल हंगर इंडेक्स इज एन एक्सपेक्टेड MCQ. इट हैज़ कम इन NEET-PG, इट हैज़ कम फॉर FMGE एग्जाम्स ऑल्सो. सो इट इज़ नॉट इन्फेंट मोर्टैलिटी रेट. हाउ डू यू रिमेंबर द इंडिकेटर्स ऑफ ग्लोबल हंगर इंडेक्स गाइज? आप कैसे याद रखोगे इंडिकेटर्स ऑफ ग्लोबल हंगर इंडेक्स? सो ऑल यू हैव टू डू इज, यू रिमेंबर आई हैव टोल्ड you in classes also, on prep app also, we have discussed in the main videos, lectures, everywhere. You have to remember this weak child, okay? Weak malnourished child, all right? Weak malnourished child, ठीक है? बहुत ही weak सा दिख रहा है, poor सा है, poor weak child who's begging on the streets, ठीक है? He comes and knocks at the door of your car, on the window of your car. So you look at the child. Now the child has inadequate food supply. He's very weak, very thin, very lean. So inadequate food supply. Inadequate food supply is going to tell us फूड जब सफिशेंट नहीं होता है, इट इज नरिशमेंट इज नॉट प्रॉपर. सो अंडर नरिशमेंट, बिकॉज ऑफ दिस inadequate food supply, what happens? It results in wasting and stunting. So what is this wasting and stunting, guys? Under nutrition. Now because of wasting and stunting, it can result in death of a child. Now the child is not necessarily 1 year old. We will go for the upper limit, U5MR, under 5 mortality rate, or you could also call it as child mortality rate. ठीक है? So infant mortality rate इसका part नहीं है. Got it? Everybody which is not a part of global hunger index, just remember this small story. Next question. Iceberg phenomenon. Which disease best represents the submerged portion in an iceberg? Which disease best represents the submerged portion in an iceberg? Influenza, rabies, chicken pox, measles. क्या mark करोगे? Okay, I am getting mixed answers. A भी आ रहा आंसर, B भी आ रहा आंसर, D भी आ रहा आंसर, C भी आ रहा, नहीं B नहीं आ रहा. A, some of you are answering A, some of you are answering D. Now guys, how could it be D? B and D तो बिल्कुल नहीं. Right, this is an iceberg. ठीक है, this is an iceberg. We compare the diseases to an iceberg. This is water around the iceberg. Now this is the tip. The tip of the iceberg represents all the diagnosed cases, all the symptomatic cases, This is the hidden portion. This hidden portion, everybody, represents what? This hidden portion of the iceberg represents the asymptomatic cases. Alright, or you could also say subclinical cases. Asymptomatic, subclinical, latent. This hidden portion, guys, contributes maximum burden. Max burden means jitna zyada prevalence. Okay, we have to, for burden, we have to always look at prevalence. This one is apparent infection, the one that we can see, apparent infection. This one is the hidden, inapparent. ठीक है, and this one is the line of demarcation which differentiates apparent from inapparent. ये जो tip है ये actually diseased है. ठीक है, what is this hidden portion? Apparently healthy, those who appear to be healthy. And what is this one, guys? This is truly healthy. Now the question was, which disease best represents the submerged portion? Now the question is, which diseases do not have the submerged portion, guys? Diseases that do not follow iceberg. What is your answer? Diseases that do not follow iceberg. Please remember, there are only 3 diseases now. MTR, measles, tetanus, rabies. मीजल्स में कभी भी सब क्लिनिकल केस कैरियर्स नहीं होते. यू ओनली हैव अ सोर्स ऑफ इन्फेक्शन. So it's just the tip. It doesn't have the hidden portion. Rabies, again, you can't have hidden cases in rabies. They can't stay hidden. Now, influenza and chickenpox both show iceberg. But for which one do you have submerged portion? Now, chickenpox you can make out by the rashes. Alright. So, less hidden cases in case of chickenpox. So for chickenpox, कैसे है? ऐसा है. समझ रहे हो? The tip is more, the iceberg, the hidden portion is smaller for chickenpox. But for influenza, what is going to happen? For influenza, this hidden portion is quite more because we often miss out cases of influenza. Now, did you understand the question, everybody? Pertussis, rubella, everybody follows iceberg phenomenon. There are only 3 diseases that do not follow iceberg, which is MTR, measles, tetanus and rabies. ठीक है? So whenever you get a question, you just have to think it this way only. Where do I have the submerged portion more? Where do I have the tip more? And accordingly, you should be able to mark your answers. Chalo. No, this is no. Now we just have 3 diseases following आइसबर्ग फेनोमेनन. दीदी कुछ खा लो आप, ठीक है? ऐसे भूख के पेट मत रहना. चलो, what is the next question, guys? How much % of GNP does WHO recommend being spent on the healthcare sector? ठीक है? What is your answer over here? WHO क्या बोलता है? 5%. GDP should be spent for any country. Gross national product. What is gross national product? The income that the country makes from within and also from outside. That is gross national product. Gross domestic product is घर का पैसा. ठीक है? Domestic means घर का. So the income that the country makes from within, that is gross domestic. Gross national is the one that you receive from abroad also. Alright, everybody. So now WHO क्या बोलता है? WHO recommends that 5% of GNP should be spent on healthcare sector. And like this was a question from one of the exams. FMG exams में क्या आया था कि national health policy of 2017, okay, national health policy, according to national health policy of 2017, what percent of GDP will India spend on health by 2025? Remember, India to spend 2.5% of GDP by 2025. Don't get mixed up. Currently, India is spending around 1.9 to 2% of GDP on health. India has promised to spend 2.5% of GNP by 2025. But अगर WHO पूछा जाए, WHO कहता है we should spend 5% of GNP on health. Clear? This is a health policy indicators. We are discussing indicators also today. So here we are talking about health policy indicators. So read the question very carefully. WHO पूछ रहा है या India पूछ रहा है? Let's go to the next one. Now let's have a look at all the levels of prevention questions which have come in exams. All the levels of prevention question. बताओ. A government plans to outline tobacco control laws. What is the level of prevention over here? Yeah, what is the level of prevention over here? Please think, primordial prevention is applied before risk factor. Primary prevention is applied, risk factor present. No disease, all right, no disease, not started. Secondary prevention is applied, disease started, all right, disease started. No complications yet, no complications yet. That means it is reversible as of now. But tertiary means disease progressed to stage of irreversibility. Disease progressed to stage of irreversibility. ठीक है? Irreversibility. Disease progress हो गया है to stage of irreversibility. That means what is happening now, guys? Complications are present. So here you just have to figure out if your government comes up with tobacco control laws. That means नाम में ही आंसर है guys. Tobacco को control करना है. That means you have to control tobacco. That means risk factor already present. Risk factor already present. So what is this law? I mean, which is this level of prevention? Primary level of prevention. Anybody has any doubt in this question? Already the risk factor is present. That is why we have come up with what? Tobacco control laws. Clear? So this is primary. We have all the questions that have come in different exams. इसको बताओ. Hand washing during COVID-19 is which level of prevention? Again, hand washing. कौन सा level of prevention है guys? Priya, over here the government is launching tobacco control laws. मतलब tobacco को control करो. इसका मतलब tobacco already release हो रहा है. That means risk factor is already present. तो कौन सा prevention apply करोगी? Primary. Over here also primary. Now in primary, over here what happens during hand washing? Why should we constantly keep washing our hand? Because risk factors are everywhere. We touch a door handle, we touch anything. The germs from my hand is to your, it has gone to that door handle, you also touch that door handle. ठीक है? So remember this one, it is primary level of prevention. ठीक है? Let's go to the next question. If counseling and screening for TB are done at an ICTC clinic, ICTC is Integrated Counseling and Testing Center for HIV patients. As per NACO guidelines, what is the level of prevention here? Anybody? हेल्थ एजुकेशन नहीं है, हैंड वॉशिंग बोला है. हैंड वॉशिंग में आपको ये देखना है कि हैंड वॉशिंग हम लोग बार बार क्यों कहते हैं हैंड वॉश करते रहो? क्योंकि रिस्क फैक्टर सब जगह प्रेजेंट है ना. रिस्क फैक्टर है तो हैंड वॉशिंग इज प्राइमरी लेवल. प्राइमोर्डियल में वी फोकस ऑन हेल्थ एजुकेशन. वी विल एजुकेट पीपल नॉट टू स्मोक, नॉट टू ड्रिंक. Primary, we focus on two things, health promotion and specific protection. ठीक है? Secondary, we focus on early diagnosis and treatment. Early diagnosis and treatment. So early diagnosis and treatment में mostly हम लोग क्या कहते हैं? Screening. Tertiary, the damage is already done. Limit the damage. Disability limitation and rehabilitation. Make people part of the society. ठीक है ना. यहाँ पे क्वेश्चन क्या था? काउंसलिंग. काउंसलिंग इज समथिंग विच इज primary and screening is something which is secondary. So what is your answer over here? Primary as well as secondary. Is it clear? Now hand washing is health promotion, guys. Hand washing can save you from a number of diseases, so it is health promotion. ठीक है. Generally hand washing क्या होता है? Health promotion होता है, because it can save you from a lot of diseases. Clear? Okay, let's go to the next one. Now tell me, vaccination and mass prophylaxis represent, what is this? Vaccination and mass prophylaxis represent. Dipanshu, counsel karna, I can counsel you for, smoking less, drinking less, ठीक है. And screening तो हमेशा secondary level होता है. ICTC centers में we are counseling the people. They have high risk behaviors. We are counseling them. We are testing them to make an early diagnosis. So primary as well as secondary. What is your answer over here, guys? Good. Vaccination and mass chemoprophylaxis. Both the risk factor is present. Let's say we give vaccine to a baby at 9 months for measles. Does the baby have measles? No. The baby is at risk of measles. ठीक है. तो vaccination क्या है? Primary level. Now particularly it protects us from diseases. So specific protection. Chemoprophylaxis. Now let's say I am traveling to a malaria endemic zone. Africa जा रही हूँ. मेरे को short term prophylaxis, less than 6 weeks travel. I will eat doxy and go. ठीक है. Eat doxy. Traveling to malaria endemic zone. Traveling to malaria endemic zone. Right now I don't have malaria, but I am at risk of malaria because मैं एक ऐसे जगह I'm going to a place where malaria is endemic, so I'm going to eat doxy and go. So that is again particularly specific protection. I am coming in exposure with a leprosy patient, so I'm at risk of developing leprosy, so I will eat single dose rifampicin. Again, that is what? Prophylaxis. Any form of prophylaxis is primary level of prevention. ठीक है. Rifampicin in contacts of leprosy. All these are what, guys? These are all specific protection. Anemia Mukt Bharat. Now what is Anemia Mukt Bharat? Again, this is specific protection. अभी anemia हो नहीं गया. We have to prevent anemia from happening. ठीक है. Yes. Alright, guys, can you just note your queries for the end? Akhtar, everybody, can you note your queries? यहाँ पे question जो था ना, guys, ICTC center था. ICTC center is a setup where we provide two things. Counseling is done for risk factor behavior. ठीक है. Treatment and testing is done for screening. Therefore it was primary and secondary. Now suppose I'm counseling a person who's already suffered from heart attack, तब वो primary नहीं होगा. So be very careful with the question. Got it? Okay. On Republic Day, a camp was organized, people were screened, so I'm not taking too much of time over here. Screening is secondary. कैसा भी एग्जाम में क्वेश्चन आए, pap smear, breast self examination, whatever, any form of screening to make an early diagnosis, to make an early checkup is secondary level of prevention. Okay, there are a couple of exceptions. ठीक है. All right, there are a couple of exceptions. We will see as we proceed in our classes. Tomorrow screening में कुछ exception आएगा. Health camps, guys. Health camps कौन सा level of prevention है? Anybody? Health camps. School health checkup. What are these? Which level of prevention? Health camps, school health checkups, any form of checkup is to make an early diagnosis. All of this will be secondary level of prevention. Clear? But there is one or two exception. I will tell you tomorrow as we proceed in our classes. Which of the following is not a primary prevention measure? Anybody? What will you mark over here? Primary prevention. सोचो guys, सोच के आंसर करो, सोच के आंसर करो. Which is not a primary prevention? Vaccination, you all know primary prevention. Salt में iodine बनाओ, double fortified salt. Why do we have a double fortified salt? Twin salt जिसको बोलते हैं double fortified salt, or we call it as twin salt. It has both iron as well as iodine in it. It is particularly given in areas which are iodine deficient areas. So it is, right now I have not developed iodine deficiency, I don't want to develop. So this is also primary prevention, specific protection. I just told you, any contact of leprosy, rifampicin खाना है, contact of meningitis. So the person who has meningitis is a risk factor for me, so I'm taking rifampicin so that I do not develop. Again, this is primary prevention, specific protection. Now here it was just written education. Health education, predominantly we are educating people to wash their hands. The question is not hand washing. Education about hand washing. So what is this one? This is primordial level of prevention. That is why I said read the question carefully. I didn't ask you hand washing is which technique over here. I am simply asking you education about hand washing. And always remember, primordial में the mode of intervention that we use guys is health education. Question hand washing नहीं था. Question था educating about hand washing. So that is primordial. Okay, let's go to the next one guys. A person going for self-health checkup to a hospital as his father died last week due to ischemia. Law of D में है, you are coming in contact with a person of meningitis. So you are at risk of meningitis. You can develop meningitis. Right now you don't have meningitis, but you can develop meningitis. So you will eat rifampicin so that you don't develop meningitis. So what is that? The disease has not yet started, but the risk factor is present. Primary level of prevention. And particularly we are focusing on meningitis, so specific protection. ठीक है, चलो, any form of health checkup is secondary. Now don't think over here that the father was a risk factor. No, father and the child may be, the son may be sharing the same behaviors. The father has died and we anyhow go for a checkup, self-health checkup. The purpose of these checkups are to make early diagnosis. ठीक है, are to make an early diagnosis. Always remember, health checkup हम किस लिए कराने जाएंगे? ये देखने के लिए कि हमारे बॉडी में कोई डिजीज तो नहीं हो रहा. So it is secondary level of prevention. Now who is going to tell me this one? Monitoring of blood pressure. Let's see if you can figure out this one. ये क्या हो गया? Guys, 1 second. Okay. Monitoring of blood pressure कौन करेगा? Good. Good. The question is monitoring. Monitoring is everyday thing. है ना? We are continuously monitoring blood pressure to see that the disease, to keep a check on hypertension, to see that disease does not progress. Alright? यहाँ पे primary मत लिख देना. Monitoring is a word. We are monitoring blood pressure every day. The purpose of monitoring, if suppose I am not hypertensive, I am not getting my blood pressure monitored every day. If I become hypertensive, then only I will get my blood pressure monitored every day. Isn't it? To see that the disease is not progressing. To see that disease is not progressing. That disease is not progressing. Alright. Here the very important word was your monitoring. Monitoring आप शुरू में नहीं करते. मतलब अगर मेरे को हाइपरटेंशन नहीं है तो मैं क्यों रोज़ मॉनिटर कराऊंगी? मॉनिटरिंग इज एन एवरीडे एक्टिविटी. बट इफ आई एम हाइपरटेंसिव, आई विल गेट माई ब्लड प्रेशर मॉनिटर्ड एवरी डे टू सी दैट आई एम नॉट प्रोग्रेसिंग इनटू अ स्टेज ऑफ इरिवर्सिबिलिटी. ठीक है. काउंसलिंग एंड थेरेपी, अगर generally they write counseling is a primary level of prevention, but again it's going to depend on the question. ठीक है. What is your answer over here? Lifestyle changes in childhood is which level of prevention? Lifestyle changes in childhood. What are you going to mark here, guys? Lifestyle changes in childhood. Lifestyle changes in childhood. अब therapy देना. बहुत तरीके की थेरेपी होती है. Somebody asked like psychotherapy. Psychotherapy is a form of treatment, all right, for mental illness. So this is secondary. If I say physiotherapy, physiotherapy is tertiary. The damage is done. Okay, I'm taking physiotherapy so that I can limit further damage. Clear? Alright, what is the answer over here? Lifestyle changes in childhood. Now, usually we adopt harmful risk factors in childhood. So, lifestyle changes, do not let the baby eat junk food, do not give them chips a lot, is to prevent obesity in childhood. So, this is primordial. But lifestyle changes in a 60-year-old is primary. क्योंकि रिस्क फैक्टर प्रेजेंट है. इन चाइल्डहुड वी डेवलप रिस्क फैक्टर्स एंड नाउ इफ आई आस्क माई लिटिल गर्ल टू डू योगा एवरी डे, आई एम प्रिवेंटिंग हर फ्रॉम बिकमिंग ओबीज, फ्रॉम डेवलपिंग रिस्क फैक्टर्स. सो इट इज प्राइमोर्डियल. क्लियर? समझ में आया? एवरीबडी, डिड यू अंडरस्टैंड? नाउ इफ एनीबडी हैज एनी डाउट प्लीज कीप इट टुवर्ड्स द एंड. क्रचेस फॉर पोलियो, spectacles, lenses, ये सब तुम्हारा क्या है? टर्शरी लेवल ऑफ प्रिवेंशन. ब्लाइंड स्कूल्स, ऑल दीज आर व्हाट? टर्शरी लेवल ऑफ प्रिवेंशन. योगा आफ्टर हार्ट अटैक, योगा आफ्टर हार्ट अटैक, हार्ट अटैक आ गया, इट इज व्हाट? टर्शरी लेवल ऑफ प्रिवेंशन. अर्ली एम्बुलेशन आफ्टर सर्जरी, टर्शरी लेवल ऑफ प्रिवेंशन टू प्रिवेंट डीवीटी. ठीक है? एनी फॉर्म ऑफ दीज क्वेश्चंस कैन कम इन योर एग्जाम्स. अर्ली एम्बुलेशन आफ्टर सर्जरी, क्योंकि सर्जरी हो गई, दैट मीन्स द डैमेज हैज ऑलरेडी बीन डन. नाउ वी आर मेकिंग हिम वॉक क्विकली एज सून एज पॉसिबल, द सूनर, टू प्रिवेंट डीवीटी. दिस अगेन इज व्हाट? टर्शरी लेवल ऑफ प्रिवेंशन. सो यू हैव टू बी वेरी केयरफुल. सीट बेल्ट्स पहनना, हेलमेट्स पहनना, ये क्या होता है? सीट बेल्ट्स, हेलमेट्स, condoms use करना. What are all these? Seat belts, helmets to prevent RTA. Right now RTA has not happened. Again primary level. Condoms to prevent unwanted pregnancies, to prevent STD. Again this is what? Primary level specific protection. ठीक है? Yeah. Got it? तो कुछ भी डाउट है, just keep it. I'll take it up when I finish the class, okay? Because we have to see a couple of more topics. What is your answer to this? Healthy person got in contact with an infected case and they have to separate him not more than the incubation period of the disease. This is an important question. You can expect something from this. देखो, सेकेंड अटैक रोकना है, ठीक है? हिस्ट्री ऑफ स्ट्रोक है, ऑलराइट, द डैमेज हैज बीन डन. अब सेकेंड अटैक, पहले तो स्ट्रोक आ गया है, सो ऑलरेडी द डैमेज हैज बीन डन. सो वेन एवर यू डू एनीथिंग टू प्रिवेंट अ रेकरेंट अटैक ऑल्सो, it is kind of a tertiary level of prevention only, because earlier the damage has been done, तभी तो second heart attack रोक रहे हैं. ठीक है? What is the answer? Absolute quarantine. Quarantine is done for healthy persons. ठीक है? And it is done for max incubation period of the disease. 2 MCQs done over here. Isolation is done for cases. Remember, quarantine and isolation both are primary level of prevention. Both are primary level. कभी मत बोलना isolation is secondary. It's not meant for treatment. We isolate cases because they are a risk factor for us. We absolute quarantine में healthy person को separate करते हैं because he is also a risk factor for us. And now quarantine की जगह what is the word that we use, guys? Quarantine has been replaced with the term active surveillance. All right, quarantine has been replaced kind of with the term active surveillance. In case कभी exam में आ गया तो. Clear? What is modified quarantine? So you can read, I've written it over here. Modified quarantine is partial limitation of freedom of movement of persons or animals or ships or flights, whatever. ठीक है? This is particularly, जैसे ये आता है एग्जाम में, एक्सक्लूजन ऑफ चिल्ड्रन फ्रॉम स्कूल, दिस इज मॉडिफाइड क्वारंटाइन. ठीक है, एब्सोल्यूट क्वारंटाइन इज फॉर द मैक्सिमम इंक्यूबेशन पीरियड ऑफ द डिजीज. मॉडिफाइड क्वारंटाइन इज पार्शियल लिमिटेशन ऑफ फ्रीडम ऑफ मूवमेंट. What is serial interval? Anybody, what is serial interval? Serial interval is the gap between onset of, it's like one episode to other. So onset of primary and secondary case. That is what is serial interval. Clear? Let's move to the next question. Paradoxical carrier क्या होता है? Anyone? ये PYQ है guys. Okay, I forgot to mention the year. Can you tell me what is paradoxical carrier? आंसर क्यों नहीं आ रहा है? रिवाइज नहीं किया ये वाला टॉपिक. हु गेट्स इन्फेक्टेड फ्रॉम अनदर कैरियर. वेरी गुड. हु गेट्स इन्फेक्टेड फ्रॉम अनदर कैरियर. ऑलराइट, पैराडॉक्सिकल कैरियर. ओके, जस्ट अ कपल ऑफ वर्ड्स. द वन हु शेड्स ऑर्गेनिज्म ड्यूरिंग रिकवरी पीरियड, दैट इज कन्वेलसेंट कैरियर. ठीक है, रिकवरी में भी ऑर्गेनिज्म शेड हो रहा है, कॉलरा में आता है ये. The one who shed organism during incubation period, incubatory carriers. I have mentioned a lot of diseases which can do. The one who gets infected from another carrier, paradoxical carrier. A virulent organism, pseudo carrier. Chronic carrier shed the organism for more than 6 months to years. Alright, so you can just note this. Typhoid, dysentery, typhoid Mary chronic carrier थी. हेपेटाइटिस बी में क्रॉनिक कैरियर्स हो सकता है, गोनोरिया में हो सकता है, मलेरिया में भी क्रॉनिक कैरियर्स हो सकता है. ठीक है, कैरियर्स वाज आस्क्ड वन लॉन्ग बैक, सो आई थॉट आई विल रिवाइज इट. ओके, व्हिच इज एन इंडेक्स ऑफ कम्युनिकेबिलिटी ऑफ इन्फेक्शन. वेरी वेरी इंपॉर्टेंट. ये क्वेश्चन ही 5 स्टार है. बताओ, which is, this can come in UPSC also guys, which is an index of communicability of an infection. Attack rate. Now what is attack rate? What is secondary attack rate? What is case fatality rate? And what is proportional mortality rate? Highly important for exams. So very good. Communicability is secondary attack rate. Communicability, transmissibility. ठीक है, transmissibility. What does case fatality rate tell you? Case fatality rate is virulence of disease. ठीक है, ये सारे क्वेश्चंस आ चुके हैं. विरुलेंस ऑफ डिजीज, सीवियरिटी ऑफ डिजीज. ठीक है, PMR क्या बताता है? प्रोपोर्शनल मोर्टेलिटी रेट. आई हैव टॉट यू बिफोर ऑल्सो. सिंपलेस्ट मेजर ऑफ बर्डन ऑफ डिजीज. सिंपलेस्ट मेजर ऑफ बर्डन ऑफ डिजीज. नाउ एनी स्टूडेंट इन द क्लास कैन टेल मी ये क्या होता है? अटैक रेट. ये आई एम श्योर यू नो ऑल दीज 3 टर्म्स. ऑप्शन बी सी डी आपको पता है. व्हाट इज ऑप्शन ए? What is attack rate? Remember, you cannot get confused between attack rate and incidence rate. Okay, attack rate is actually a proportion. That means multiplier is 100, which we calculate guys during an outbreak. Okay, so some of you come up with the question, what I have what I have done over here. I have written it for you. Attack rate is a proportion that measures occurrence of new cases during a specific outbreak. Incidence क्या होता है? It's a rate. Multiplier is 100. Attack rate is multiplier 100. ठीक है, ये proportion है जिसको आप outbreak में यूज करोगे. Total population at risk and how many new cases. Incidence क्या होता है? How many new cases out of total population at risk into 1000. Clear? So don't get confused. Attack rate is something which we particularly calculate during outbreaks. Clear? And this was asked a couple of times. जैसे SAR, chicken pox, pertussis और rubella, इन सब का 90% है. Mumps 86%, measles 80%. Some common diseases SAR you should know. Last time also they've asked a lot of questions on SAR and all that, so you should know this one also. ठीक है, the normal this thing. Okay, all right. Now let's do a numerical for secondary attack rate. Can you quickly tell me the answer to this, guys? Please solve the question. What is the SAR of chickenpox over here? Yeah, out of susceptible contacts. You are absolutely correct. इसका आंसर क्या है? Okay, getting answers over here. D, B, D, C, D, B, C, D. क्या होता है secondary attack rate? Secondary attack rate, everybody, is, what is secondary attack rate? Secondary attack rate is total number of secondary cases that develop following single incubation period of the disease out of the total number of susceptibles. And always remember, secondary attack rate, guys, is expressed in terms of what? It is expressed in terms of percentage. So we will multiply with 100. Now over here you have 50 children. 10 are immunized. So how many are safe, guys? How many are safe? 10. ठीक है? Alright. And how many are susceptible? How many are susceptible? Susceptible कितने हैं? 50 में से 10 हटा दो. 50 में से 10 हटाओ. 50 minus 10. 40 are susceptible. Do you all agree? Now what happens? 5 children develop chickenpox on 1st of March. So these 5 children who develop chickenpox, 5 children 1st of March, जिनको chickenpox होता है guys, ये क्या है? Primary cases. So now following them, 28 children developed within the next 2 weeks. So these 28 children are what, everybody? They are your secondary cases. Clear? Now what is secondary attack rate, everybody? Total number of secondary cases. So how many are secondary cases? 28. What about the total number of susceptibles, everybody? It was 40. But 40 में से 5 became primary case. Minus 5 into 100. So what is your answer over here? What is your answer? कितना आया तुम्हारा answer? Yeah, 7 4s are. What was the mistake that you all did? Somebody wrote it. Travel with Dr. Raj wrote 28 out of 35. C, किसने किसने आंसर C दिया था? Guys, you cannot make this mistake. No? ठीक है? Now you can see that 10 are immunized. So susceptible, they are safe. So susceptible are 40. Alright, out of this 5 developed chickenpox on 1st of March. They are the primary cases. 28 are the secondary cases. So 28 out of the total number of susceptibles. Total number of susceptibles would be 40, but out of them 5 were the primary case. So 40 minus 5. Always and never ever 28 यहाँ लिखा हुआ है ना, other 28. 1st of March को 5 children developed chickenpox. So they are the primary cases. And other 28 developed next 2 weeks. That means they have developed in coming in exposure to the primary case. So 28 तुम्हारा क्या है? Secondary case है. Everybody got it? Never forget to subtract the primary case from number of susceptibles. Okay? Please subtract primary case from number of susceptibles. कभी भूलना नहीं. Subtract primary case from number of susceptibles. You cannot forget to do that. Okay? Alright. What is the denominator used in calculation of CFR? ठीक है? What is the denominator used in calculation of CFR? मत भूलना. You know what, in exam they will deliberately give an option where the answer would be 35 by 40 into 100. Trust me. मतलब 28 by 40 into 100. पक्का एक option होगा, but you are not supposed to mark that. You have to remove the number of susceptibles. Good. This I am sure everybody knows. Case fatality rate क्या होता है? Total deaths due to a disease, a particular disease, out of the total number of cases due to a disease, due to the disease, and you're also multiplying it with 100. So this is what? CFR, case fatality rate. It is a measure of virulence or severity. So quickly, as fast as possible, calculate CFR in this. Calculate CFR in this. A total of 60 patients were diagnosed with COVID-19, out of which 12 cases of deaths reported. Calculate CFR. What is your answer here? Good. Total deaths out of the total cases multiplied by 100. 12 cases of death, total cases 60 into 100. So that is how much? 20%. Secondary attack rate, case fatality rate, दोनों पढ़ के जाना है. Secondary attack rate is communicability, transmissibility. Case fatality rate is virulence or severity. Okay, what is the answer to this? Which of the following is used to estimate the burden of disease in a community? Out of this, what will you use? I'm asking you burden of disease. What do you want to calculate for burden of disease? क्या हो रहा है ये? अगर मैं अभी आपको बोलूं, let's stop the class, let's go to the community outside and look for burden of diabetes. क्या करोगे? Will you start calculating DALY? Is it so easy to calculate? No guys. DALY is the best measure of burden, alright? Best measure of burden of disease. If we have to estimate best measure of burden, I'm asking, I have to just go to the community. So what am I going to do? I am going to do from these particular options. Secondary attack rate is communicability. It's not the burden. Case fatality rate is virulence. Burden of disease is proportional mortality rate. Not secondary. Secondary attack rate is transmissibility. That is not burden. Proportion mortality rate क्या होता है? Total deaths in a community. Alright, total deaths in a community. Out of that, deaths due to a disease. Alright, into 100 again. This is PMR. I've told you proportional mortality rate is the simplest measure of burden of disease. अगर क्वेश्चन आता बर्डन देखना है डायबिटीज का कम्युनिटी में, we'll go and calculate the prevalence. Prevalence is proportion. Clear? Did you get it? Don't get confused. Look at me, everyone. I'll send out a post also today. Simplest measure of burden is proportional mortality. Best measure of burden is DALY. Communicability, transmissibility, secondary attack rate. Virulence, severity of disease, case fatality rate. आगे पीछे उल्टा पुल्टा नहीं करना है. क्लियर? और क्वेश्चन अगर यही आता कि चलो कम्युनिटी में जाके बर्डन ऑफ डायबिटीज देखते हैं, सो व्हाट इज द बेस्ट थिंग यू कैन डू टू फाइंड आउट द बर्डन? यू कैन जस्ट चेक आउट द प्रेवलेंस. ओके, डू द क्वेश्चन. व्हाट इज PMR रेट फ्रॉम TB? प्रोपोर्शनल मोर्टालिटी रेट फ्रॉम TB गाइस. So we'll be able to do the session for 20 more minutes. In case any question is left, I'll take it up tomorrow in screening. Okay? एक टेबल अभी बना दूंगी, ठीक है? Let me finish it, Milan. I'll make that table. I'll share it on Telegram. I'll share it on Insta. I'll share it everybody. Today the table will be out. Okay? Let me just wrap it up. फिर करते हैं. PMR क्या हो जाता है? TB बोल रहे हैं. So again, total deaths. Out of that, proportion means out of the total, how many due to something. Proportion of boys in the class today. Out of the total students, how many are boys? Out of the total students, how many are girls? ठीक है? So deaths due to TB. Again multiplier 100. SAR, CFR, PMR. सब में तुम्हारा multiplier 100 है, भूलना नहीं. ठीक है? So deaths due to TB, 10 individuals died. And total 100 deaths हुए थे into 100. So obviously you don't need a paper pen for this. Your answer is 10%. ठीक है? So these three terms are important. The area is declared free of epidemic. When do you declare the area free of an epidemic, guys? When do you declare an area free of an epidemic? When do you declare an area free of an epidemic? CFR होता है विरुलेंस, डिजीज कितना सीवियर है, मतलब अगर इतने केसेस किसी डिजीज के हो रहे हैं तो कितने लोग मर जाएंगे, दैट इज CFR. PMR होता है अगर इतने डेथ किसी कम्युनिटी में हो रहे हैं तो किसी डिजीज की वजह से कितना डेथ हो रहा है, वो PMR है. ठीक है, ऑलराइट. Area is declared free of epidemic when no new case is reported for twice the incubation period of the disease since the last case. Twice the incubation period. They could ask you to calculate also. So it is twice the incubation. And remember, most important step in investigation of an epidemic, most important step in epidemic investigation क्या है? Most important step in epidemic investigation. Don't say confirm existence of an epidemic. No. Confirm diagnosis. पहले diagnosis confirm करोगे, then you're going to confirm the existence of an epidemic. Okay? चलो, next one. A 35-year-old man is unemployed because he is unable to walk after an accident. His unemployment is classified as, what is your answer here? Yes, his unemployment is handicap. I hope you remember unemployment पूछा था, DIDH. DID could be disease, alright, like accident. Now because of the accident the foot is lost, loss of legs or something, this is impairment. Disease leads to impairment. Now because of loss of legs cannot walk, okay, cannot walk. And when any of our activity gets restricted, guys, it is disability. Iti means activity. Now because of cannot walk, unemployment, loses job, unemployment, that is what? Handicap. Handicap means we can't fulfill our roles and responsibilities. अगर मैंने पूछा होता cannot walk, that is disability. ठीक है, DITH. Okay, next one. Which of the following demographic indicators is used to compare the life expectancy of two different countries? Okay, that's good. Net UGC का exam 27 जून है. सारे एग्जाम्स आर ऑलमोस्ट वेरी क्लियर. 26 जून 27 जून तो हो गया ना, 27 ओके राइट. 26 जुलाई, 4 अगस्त, 3 अगस्त. क्या है आंसर? HDI. गुड. HDI में यू हैव द लाइफ एक्सपेक्टेंसीज. ओके, ह्यूमन पॉवर्टी इंडेक्स आजकल यूज नहीं होता. दिस हैज बीन रिप्लेस्ड बाय MDPI, मल्टी डिमेंशनल पॉवर्टी इंडेक्स, जिसमें 3 चीज़ें यूज होती हैं गाइज. पॉवर्टी इज अ हेल. सो हेल्थ एजुकेशन, living standards, okay, or assets, all right, living standards, or you can say assets that we have. Remember, when we have to assess poverty, we don't use occupation. We are not concerned about education, we are concerned about HEL, health. ठीक है, health, education, living standards. MDPI is a measure of acute poverty. It has replaced human poverty index. Okay, क्योंकि HDI में you have life expectancy, so that is the answer over here. एक quickly बताओ, year of potential life lost could be attributed to. Year of potential life lost could be attributed to year lost to morbidity, year lost due to premature death, year lost to disability, year lost to poor quality of life. Year of potential life lost is due to, very good, you remember DALI is YLL plus YLD. Year lost to years of life lost due to premature death. And this is years lived with disability. So the answer is option B. Not years of potential life lost is due to premature death ना, years lost to disability क्यों बोल रहे हो? Clear? So I just ask you years of potential life lost, that is due to premature death. Okay. Let's go to the next MCQ. What's this? The best indicator for development in terms of availability and utilization of healthcare of a country. Availability, utilization, effectiveness of healthcare services. देखो डाली में दोनों आता है, डाली इज YLL प्लस YLD. YLL is years of life lost to premature death. I asked you about this only, so it is due to premature death. YLD is another aspect of DALI, which is years lived with disability. Okay, this answer to this: availability, utilization, effectiveness, health status, everything. The best answer to this is IMR. Okay, if I mention according to UN, if ever we add according to UN, then it is under 5 mortality. Otherwise the answer is always IMR. ठीक है? All right. Disease elimination refers to best indicator of health status of a country, best indicators of availability, utilization, effectiveness, सब infant mortality rate है. Good. Disease elimination. Extinction नहीं. Extinction क्या होता है? Extinction is when agent no longer maintained under lab conditions. Okay. See, once an agent is eradicated, we still maintain it under lab conditions and supervised conditions. ठीक है? But when agent is no longer maintained under lab conditions, alright, then we say it is extinct. It is no longer maintained under lab conditions after eradication. ठीक है? After eradication के बाद भी हम लोग lab conditions में agent को maintain करते हैं under some supervised. But if it is no longer maintained, it is extinct. Termination of all disease is eradication. Okay, global removal of disease agent is eradication. Elimination is a regional removal of the agent. Regional means it could be from a country, it could also be WHO specific region. ठीक है? Regional, it always has an area of element associated to it. Causative agent तो है but कोई transmission नहीं है. What is the answer to this? Causative agent is there but there is no transmission. What is your answer to this? Causative agent present but कोई transmission नहीं है. So what is it? It is elimination. Eradication मतलब agent no longer exists. Agent no longer exists. Agent ही नहीं है. Elimination मतलब complete interruption of all modes of transmission. Complete interruption of all modes of transmission. सारे modes of transmission को completely interrupt कर लिया. Control क्या होता है? Reduce. Completely खत्म नहीं किया है? Reduce. Reduce incidence of a disease. New cases कम हो गए. Reduce duration of a disease. All right, reduce modes of transmission. Agar if we completely finish all the modes, elimination, but if we reduce it, control. Reduce financial burden due to a disease. Reduce complications due to a disease till the disease is no longer a public health problem. वो होता है control. ठीक है? कंट्रोल मतलब कम करो, कंट्रोल योर अनहेल्दी बिहेवियर्स. एलिमिनेट मतलब खत्म करो अनहेल्दी बिहेवियर्स. ठीक है? ओके, which is not a mortality indicator. Guys, I'll be able to take the class for 10 more minutes. If I am left with a couple of questions, I will take it up tomorrow. ठीक है? जैसे epidemics, I might also discuss them in your image based session that we're going to have on the 4th. ठीक है? Yeah, guinea worm eliminate हो चुका है इंडिया से. पोलियो is no longer there, leprosy is no longer there, guinea worm is no longer there, infective trachoma is no longer there. Okay, all these have been eliminated. Prevalence, very good. Prevalence is a morbidity indicator. Life expectancy is a positive mortality indicator. So, you could just go through all the morbidity indicators once. Morbidity tells us about the burden. Morbidity indicators के नाम देख लेना. इस PDF में रहेंगे. They tell us about the burden. Okay, so most important ones, of course, incidence and prevalence. They are morbidity, disease notification rate, attendance rate, admission rate, duration of stay at hospitals, spells of sickness, sickness absenteeism. ये सारे क्या है तुम्हारे morbidity indicators. ठीक है? Okay, go to the next one. ये तो हमने डिस्कस कर लिया, फिर भी आंसर दे दो. मोस्ट यूनिवर्सली एक्सेप्टेड इंडिकेटर ऑफ हेल्थ स्टेटस ऑफ होल पॉपुलेशन एंड द सोशो इकोनॉमिक कंडीशंस अमंग द फॉलोइंग इज IMR. गुड. अगर क्वेश्चन में लिखा होता अकॉर्डिंग टू UN, then your answer will be U5MR. Be careful with them. If it's not written according to UN, of course it is IMR. Okay. Let's go to the next question, guys. Let me explain you DALI, QALY, and the rest we'll take up tomorrow. Okay. Epidemics का portion I will cover in the images class. ठीक है. The average life expectancy for women in Japan is 87 years due to recent advances in testing for cervical cancer, increase in life expectancy by 15 years. Healthcare utility value is 0.8. Now what is this? HALE. What was HALE? Health adjusted life years. Suppose somebody develops cancer, the quality of life will reduce. You will take a medical intervention. Now because of that medical intervention, how many years get added to his life? That is HALE. And HALE में there will be a buzzword, guys, for the interventions. जो भी interventions होते हैं ना that you can offer, we can offer a couple of interventions to a person suffering from cancer. So we look at the utility, cost utility of interventions. Okay, cost utility देखते हैं interventions का, and whichever has the good cost utility factor उसको ले लिया जाता है. अब मान लो यहाँ पे क्वेश्चन आ गया calculate QALY. Can you calculate it? Can you calculate QALY? How will you calculate QALY over here? Not at all difficult. Life expectancy has increased by how many years? 15 years. What is the utility value? 0.8. So what is the QALY? 12. ठीक है? Oh, I marked HALE. I'm so sorry. QALY है इसका आंसर. QALY में पढ़ा रही हूँ, मार्क HALE कर दी. So don't do that in exams, okay? मतलब बोल कुछ रहे हो, मार्क कुछ करके आ जाओ. Don't do that. Alright. Okay. So quality. I sometimes tend to show you the mistakes you can make. है ना? Because when you sit for entrances, you know, you have to be very careful about the mistakes that we do. Because थोड़ी देरी में ना your mind actually gets a little lost. Alright, so it starts wandering somewhere else. Don't let that happen to you in exams. And how can you not let that happen to you in exams? By practicing every day. चलो, ये हो गया तुम्हारा QALY. Okay, what is the next answer? A question. Measure the number of years a newborn would be expected to live in full health. अगर buzzword दिखा full health, what is your answer? If you see the buzzword full health, what will be your answer over there, guys? If you see the buzzword full health, okay. Full health में the answer is HALE. The number of years a newborn is expected to live in full health. DALI, you all know, years of life lost, years lived with disability. Maximum DALI is contributed by cardiovascular diseases, actually CAD. What is Sullivan's index? Sullivan's index is life expectancy minus duration of disability. Disability free life expectancy. Okay, this is what? Disability free life expectancy. Disability free life expectancy. That is Sullivan's index. Best measure burden of disease. Best measure of burden of disease, DALI. But अगर question आया best measure of cost effectiveness of interventions, cost effectiveness of interventions, all right, cost effectiveness of interventions, that is QALY. अगर word cost effective लग दिया, that is QALY. ठीक है? Okay, 2-3 more questions. What is the answer to this? Best measure of overall burden of disease, already done it. So can I tick it and move forward? Best measure of overall burden of disease, what is the answer over here? Guys, I'm getting a call, just give me 1 second. ठीक है. So best measure of burden is DALI. Best measure of burden and effectiveness of intervention, DALI. Best measure of cost effectiveness of intervention, QALY. Which of the following is event type disability indicator? Disability indicator दो तरीके के हो सकते हैं guys, event type and person type. So which of the following is event type? Anybody? neetpg में आया था, can get repeated for FMGE exams also. Event type. Now एक होता है person type, एक होता है event type. So event type is not C, not C, not C. Person type is, remember ऐसे, देखो, let me take you to this. Can you see this? Just read this once, because I knew you might not remember this. Person type में mnemonic is PL. Person की limitation. Person has limitations, right? So person has limitation of mobility, limitation of activity. Event type, number of days of restricted activity. Somebody gets paralyzed, so how many days of restricted activity? How many days he is bedridden? How many days he lost from work? Event type. Person type, person has limitations, so PL. ठीक है? Clear everybody? That's how you can remember this. That's why I gave this question, because maybe you could be asked about this question. Alright, last couple of questions. All of the following are utilization rates except health utilization indicator and healthcare delivery indicator. What is the answer to this? Healthcare delivery जो हम दे रहे हैं, जो गवर्नमेंट दे रही है. Alright, utilization is something that we are utilizing. How many bed occupancy rates hospital में क्या है, bed turnover rates क्या है, average length of stay क्या है, ठीक है. But population bed ratio, this is something that the government is giving us. Okay, so if you talk about healthcare utilization, bed occupancy, average length of stay in the hospital, bed turnover ratio, infants fully immunized, couples using family planning, pregnant females using ANC services. But what is healthcare delivery indicators? What the government gives you? Doctor population ratio, doctor nurse ratio, one doctor for every 1,000 population, one nurse for every 5,000 population, okay? One sub-center for every 5,000 population. So that is your healthcare delivery indicators. Done everyone. Coming to the last question of the day guys. नीति आयोग. ये ना मैंने एक बनाया है क्वेश्चन, बिकॉज दिस इज फ्रॉम योर टेक्स्ट बुक ऑफ पार्क गाइज. They have always asked Niti Aayog, what if they give you this time? All indicators are used by Niti Aayog in calculating health index of India. Niti Aayog helps us calculate health index of India. So when we have to calculate health index of India, Niti Aayog uses all of that except, बस पढ़ लो इसको. Health outcomes, governance and information key inputs तीनों लेते हैं. सोशल एंड इकोनॉमिक कैरेक्टरिस्टिक्स नहीं कंसिडर करते, ठीक है. नीति आयोग एवरीबडी इज नेशनल इंस्टीट्यूशन फॉर ट्रांसफॉर्मिंग इंडिया. इट केम इनटू एग्जिस्टेंस Jan 1st 2015, replaced the planning commission. All right, it is the think tank of India. All right, it frames all important policies. Got it? ठीक है? Okay. All are components of epidemiological triad for TB except, what is triad? Agent, host, environment. So which is not a component of epidemiological triad of TB here? General health checkup is to make an early diagnosis. It's screening. इसमें से फिगर आउट करो. एजेंट क्या है? एजेंट माइकोबैक्टीरियम टीबी. होस्ट कौन है? मैलनरिश्ड चाइल्ड. ओवर क्राउडिंग क्या है? एनवायरमेंट. सो विच इज नॉट ओवर हियर? ड्यूरेशन ऑफ डिजीज. ड्यूरेशन ऑफ डिजीज जब हम लोग लेंगे, टाइम फैक्टर, ड्यूरेशन, इट विल बी एपिडेमियोलॉजिकल ट्रायंगल. इट विल बी एपिडेमियोलॉजिकल ट्रायंगल. एंड देयर इज वन agent is replaced by causative factors. Agent replaced by causative factors. Host, environment. This is what? Time. This is what? Advanced model of triangle of epidemiology. Advanced model of triangle of epidemiology. ठीक है, instead of asking you directly what is epidemiological triad, interaction and interdependence of agent host environment, I can ask it this way. So you all had to figure out that okay, agent TB हो गया, overcrowding environment हो गया, malnourished child host हो गया. ठीक है. So that's it for today, guys. In the unannotated PDF, you might form a couple of questions about, yeah, एक काम करते 2 minutes, okay? Let's wrap up these MCQs. What is the answer to this? In a disease outbreak, it's 2 minutes as fast as you can write, okay? In a disease outbreak, maximum infectivity was observed on the 5th day. What is this period called? 2 more minutes. जितनी जल्दी हो सके इसका आंसर लिखो, एक्सप्लेनेशन कर दूंगी. ठीक है. मैक्सिमम इन्फेक्टिविटी वॉज ऑब्जर्व्ड ऑन द 5th डे. मैक्सिमम इन्फेक्टिविटी इन एंट्री ऑफ ऑर्गेनिज्म टू मैक्सिमम इन्फेक्टिविटी गाइज इज व्हाट? जनरेशन टाइम. डी कहाँ से आ गया? मैक्सिमम इन्फेक्टिविटी. द बजवर्ड इज जनरेशन टाइम. मीडियन इंक्यूबेशन पीरियड इज 50%. 50% of cases. Time between entry of organism to 50% of cases to occur. That is median incubation. All right. Okay. So we're going to talk about one last question. Changes in disease occurrence over long periods is known as, last question. ठीक है. Changes in disease occurrence over long period. Long period मतलब this is what? Secular trend. Long period means at least over a decade. At least over a decade. Okay. So that's it for today, guys. I will see you again tomorrow. There are just 2-3 questions left that we will take up tomorrow. And keep revising, keep studying, and I'll see you all tomorrow. Okay. Bye-bye. Any doubts, any query? Yes, they are going to equally work for neetpg as well as FMGE exams for your INI-CT also. Don't worry about exams में questions कैसे. These are sessions to master and revise the PYTs. Questions में थोड़ा सा you obviously have to think. Now all the doubts I will take up tomorrow, guys, and tomorrow is screening, and 1 or 2 questions that are left I'll take it up tomorrow.